What if I told you that the most popular supplement combination for seniors, the one sitting in your medicine cabinet right now, could be silently destroying your kidneys? I'm talking about vitamin D3 and K2. Yes, the same pills your doctor might have recommended for bone health. The same ones all over social media promising stronger bones and a healthier heart. But here's what nobody's telling you. When taken incorrectly, especially after age 50, this combo could be creating microscopic damage inside your kidneys that you won't feel until it's too late. I'm Dr. Elise, and what I'm about to share with you today could change everything you thought you knew about these supplements. Before we go any further, if you care about protecting your health as you age, hit that subscribe button right now. Because on Senior Vitality Pro, we don't just repeat what everyone else is saying. We dig into the science, we tell you the truth, and we give you practical solutions you can use today. Now stay with me, because in the next 60 seconds, I'm going to reveal why timing matters more than dosage, why your kidneys are struggling to keep up, and the one mineral deficiency that's making everything worse. This isn't about scaring you. It's about empowering you with knowledge that could save your kidney function, your energy, and your quality of life for the next 20 or 30 years. Let me tell you about something I see almost every week in my practice. A woman in her late 50s comes in for her annual checkup. She's active, eats relatively well, and takes her supplements religiously every morning. When I review her labs, I notice something concerning. Her kidney function numbers are declining. Not dramatically, but steadily. Her creatinine is creeping up, and her GFR, that's the glomerular filtration rate that tells us how well her kidneys are filtering, is lower than it should be for her age. When I ask about her supplement routine, she pulls out a bottle of D3 and K2, 5,000 IU of vitamin D3, 200 micrograms of K2, taken every single morning for the past 3 years. She's confused when I express concern. After all, isn't this supposed to be good for her bones? Isn't K2 supposed to keep calcium out of her arteries? Here's what's really happening inside her body, and possibly inside yours too. Every time you take vitamin D3, it acts like a key that unlocks your intestines, allowing them to absorb much more calcium from your food. That calcium floods into your bloodstream. Now, your body is supposed to use that calcium for your bones, and then your kidneys are supposed to filter out the excess. But here's the problem most people never consider. After age 50, your kidney filtration naturally slows down. It's just part of aging. Your kidneys can't process minerals as quickly as they did when you were 30 or 40. So when you're taking high doses of D3 every single day, you're essentially asking your aging kidneys to handle a calcium traffic jam they're not equipped for anymore. Day after day, week after week, month after month, small calcium crystals start forming inside your kidney tissue. You don't feel it happening. There's no pain, no obvious symptoms. But over time, this leads to inflammation, reduced kidney function, and eventually kidney stones, or even chronic kidney disease. Now this is where vitamin K2 comes into the story. K2 is marketed as the solution to this calcium problem. It's supposed to activate proteins that direct calcium into your bones and away from your soft tissues, including your kidneys and arteries. And yes, K2 does play this role, but only when everything else in your body is balanced. The truth is, K2 can't keep up when you're overloading your system with too much vitamin D3, especially if you're deficient in magnesium, which most seniors are. Think of it this way. Imagine K2 is a traffic officer trying to direct cars, that's calcium, to the right destination. But if there are too many cars flooding the intersection all at once, even the best traffic officer gets overwhelmed. The cars start backing up, some go the wrong way, and eventually there's chaos. That's exactly what's happening in your body when you take high-dose D3 and K2 together without proper balance, hydration, or magnesium support. Let me explain something else that almost nobody talks about. Your kidneys don't just filter calcium. They also activate vitamin D, That's right. The vitamin D3 you swallow has to be converted by your kidneys into its active form called calcitriol before your body can actually use it. So when your kidneys are overworked, inflamed, or stressed from processing too much calcium, they lose their ability to activate vitamin D properly. This creates a vicious cycle. You take more D3 to boost your levels, but your struggling kidneys can't process it efficiently. So you keep taking more, thinking you need more, when in reality, you're just making the problem worse. I've seen this pattern in countless blood tests. Seniors with normal calcium levels on paper, but their kidney function markers, creatinine and GFR, are quietly deteriorating. And when I dig deeper, they've been taking 5,000, even 10,000 IU of vitamin D3 daily, often with that K2 combo pill, thinking they're being proactive about their health. Here's another critical piece most people miss. These combo pills don't come with instructions about timing or food interactions. Most people take them first thing in the morning, often on an empty stomach or with a calcium-rich breakfast, like cereal with milk, yogurt, or a protein shake with added calcium. This is a huge mistake. You're doubling, sometimes tripling, the amount of calcium hitting your bloodstream all at once. Your kidneys have to deal with this massive surge every single morning, and over months and years, it takes a toll. Instead of strengthening your bones, you could be setting yourself up for what I call calcium mismanagement, a situation where calcium hardens your arteries, clogs your kidneys, and ironically, weakens your bones because your body's regulation systems are out of balance. This is silent, it's serious, and it's more common than you think. Now, I want to be crystal clear about something. I'm not saying vitamin D3 and K2 are bad nutrients. They're essential. Your body needs them. But here's the truth that the supplement industry doesn't want you to know. The dose matters, the timing matters, and your individual health status matters more than anything on that label. You can't take a one-size-fits-all approach to supplements, especially after age 50 when your body's processing abilities change dramatically. Your metabolism isn't what it used to be. Your liver and kidneys work harder to process everything you consume. Your digestive system absorbs nutrients differently. Even your cellular response to vitamins changes with age. This is why the same supplement that worked perfectly for you at 40 might be causing problems at 60 or 70. Your body is constantly evolving, and your supplement strategy needs to evolve with it. So what do? How do you get the benefits of these vitamins without putting your kidneys at risk? That's exactly what I'm going to walk you through right now, step by step, with practical, evidence-based strategies you can start using today. First, let's talk about timing, because when you take these supplements, matters just as much as how much you take. Vitamin D3 and K2 are both fat-soluble vitamins. That means they need dietary fat to be absorbed properly. If you take them on an empty stomach, most of the supplement passes right through you unused. What little does get absorbed can spike your blood calcium levels too quickly, putting unnecessary stress on your kidneys. Here's what you should do instead. Take your D3 and K2 after a meal that contains healthy fats. Think avocado, olive oil, salmon, nuts, or even a couple of eggs. This slows down the absorption, allows your body to process the calcium more evenly throughout the day, and significantly reduces the burden on your kidneys. It's a simple change, but it makes a massive difference in how your body handles these nutrients. Now let's talk about dosage, because this is where most people go completely wrong. Walk into any health store and you'll see bottles promoting 5,000, even 10,000 IU of vitamin D3 daily. Social media influencers are telling seniors to take these high doses for optimal health. But here's what the actual science says. Most adults over 50 only need about 1,000 to 2,000 IU of vitamin D3 per day, and that's only if blood tests confirm you're deficient. The optimal blood range for vitamin D is between 40 and 60 nanograms per milliliter. Anything beyond that range doesn't give you extra benefits. It just increases your risk of toxicity and kidney stress. As for vitamin K2, research shows that 90 to 120 micrograms per day is sufficient for most adults. More isn't better. Your body can only use so much, and the rest just becomes metabolic waste that your kidneys have to process and eliminate. So before you reach for that high-dose combo bottle, pause. Make an appointment with your doctor and ask for a simple blood test. You want to check your vitamin D levels, and just as importantly, you want to check your kidney function. Look at your creatinine and GFR numbers. These tell you how well your kidneys are filtering. If your vitamin D levels are already in the optimal range, you might not need to supplement at all, or you might only need a very low dose a few times a week instead of every day. This is personalized medicine, and it's the only way to supplement safely as you age. Now here's something crucial that almost nobody talks about, and it might be the most important piece of this entire puzzle: magnesium. Vitamin D3 cannot be activated in your body without sufficient magnesium. Let me say that again because it's that important. Without enough magnesium, the vitamin D3 you're taking can't convert into its active form, which means your calcium regulation breaks down completely. Magnesium also relaxes your blood vessels, reduces inflammation, and directly supports kidney function. It helps your kidneys process and eliminate excess calcium. Yet studies show that nearly half of all adults over 50 are deficient in magnesium, and most people have no idea. If you're taking high doses of vitamin D3 without adequate magnesium, you're essentially pouring gasoline on a fire. You're increasing calcium absorption without giving your body the tools it needs to manage that calcium properly. The result: calcium deposits in your kidneys, your arteries, and your joints, while your bones stay weak. It's the exact opposite of what you're trying to achieve. So what do? Start including magnesium-rich foods in your diet every single day. Leafy greens like spinach and kale, pumpkin seeds, almonds, and yes, even dark chocolate. These are excellent sources. If you want to supplement, magnesium glycinate or magnesium citrate are the most gentle and well-absorbed forms. I recommend taking magnesium in the evening because it also helps relax your muscles and improves sleep quality, which is another huge benefit for seniors. Hydration is another simple but incredibly powerful way to protect your kidneys, and it's something most seniors underestimate. Your kidneys need water to function properly. Water helps flush out excess minerals, including calcium, and reduces the risk of crystal formation and kidney stones. Aim for about 6 to 8 glasses of water per day, unless your doctor has advised otherwise for a specific medical condition. If you're drinking coffee or tea, and most of us are, balance each cup with an extra glass of water because caffeine is a diuretic. It makes you lose fluid. Here's a simple trick I teach my patients. Add a squeeze of fresh lemon to your water. The citric acid in lemon helps dissolve small calcium crystals before they can grow into stones. It's a small habit with a big impact over time. I also recommend spreading your water intake throughout the day rather than drinking large amounts all at once. Your kidneys work best with a steady, consistent flow of fluids. Now let's talk about lifestyle, because supplements can never, and I mean never, replace healthy daily habits. One of the best things you can do for your vitamin D levels is to spend a little time in natural sunlight every day. Even just 15 minutes with your arms and face exposed can help your body produce vitamin D naturally, and your body handles this form of vitamin D far more efficiently than any pill. It knows exactly how much to make and when to stop. You don't get that same regulation with supplements. The sunlight method is self-regulating. Your skin stops producing vitamin D once you've made enough, which means there's no risk of overdose or kidney stress. Try to get your sunlight exposure in the morning or late afternoon when the UV rays are less intense. You're not trying to tan. You're just giving your body the light it needs to produce this essential nutrient naturally. Eat foods that naturally support kidney health. Berries like blueberries, cranberries, and strawberries contain powerful antioxidants that reduce inflammation in your kidney tissue. Garlic and onions support circulation and reduce oxidative stress. Omega-3 rich foods like salmon, chia seeds, and walnuts lower inflammation and improve blood flow to your kidneys. Cruciferous vegetables like broccoli and cauliflower help your liver process toxins before they reach your kidneys. And here's something important. Limit processed salt and added sugar. These are two of the biggest enemies of kidney health. Too much sodium traps fluid in your body and strains your kidneys. Too much sugar causes insulin spikes that damage the delicate blood vessels inside your kidneys over time. When you're cooking at home, use herbs and spices for flavor instead of salt. Choose whole fruits over fruit juices to avoid sugar spikes. These small changes add up to major kidney protection over the years. Here's another mistake I see all the time. People unknowingly stack their supplements without realizing it. You might be taking a multivitamin that already contains vitamin D3 and K2, and then you add a separate D3K2 combo pill on top of that. Maybe you're also drinking fortified milk or eating fortified cereals. This kind of layering can push your nutrient levels dangerously high without you even knowing it. Always read your labels carefully. Check every supplement you're taking and make sure you're not doubling up on the same nutrients. Keep a simple list of all your supplements with their exact dosages. Review this list with your doctor at least once a year. If you've already been taking a high-dose D3K2 combo for months or even years, don't panic. Your body has an incredible ability to heal and recover when you give it the right conditions. You can help your kidneys bounce back by making small, intentional adjustments starting today. Lower your dose, take breaks between supplement cycles, stay hydrated, and get your blood levels checked at least twice a year. These simple steps can reverse early damage and protect your kidneys for the long term. Now let's talk about recognizing the early warning signs that your kidneys might be under stress, because kidney damage is often silent. You can feel perfectly fine until the problem becomes advanced. Your kidneys filter about 150 quarts of blood every single day. They remove toxins, balance minerals, and keep your blood pressure steady. When they start struggling, the signs can be subtle and easy to dismiss as normal aging. Here's what to watch for. You might notice you're feeling more fatigued than usual, even after a full night's sleep. That's because your kidneys help regulate red blood cell production. When they're under pressure, oxygen delivery to your tissues drops, making you feel sluggish and weak. This isn't the normal tiredness from a busy day. It's a persistent, heavy fatigue that doesn't improve with rest. Another common sign is puffiness or swelling, especially around your eyes, ankles, or hands. This happens when your kidneys can't remove excess fluid efficiently. It's not always dramatic. Sometimes it's just a little morning puffiness that you might brush off as getting older. Pay close attention to changes in your urination. Darker urine, foamy bubbles, or needing to go more or less often than usual can all be early indicators. Foaminess can mean protein is leaking into your urine, which is a classic sign of kidney stress. If your urine looks like beer or cola, that's concentrated, and your kidneys might be struggling. You might also notice your blood pressure creeping up. Your kidneys help regulate blood vessel tone, so when they're inflamed or overloaded, your vessels tighten and pressure rises. Even if you've never had blood pressure issues before, suddenly developing high blood pressure after age 50, especially when you're taking supplements regularly, is worth investigating. Even subtle back pain, right below your ribs on either side, can sometimes indicate kidney strain, especially when combined with other symptoms. Some people describe it as a dull ache that comes and goes. Others feel tenderness when pressure is applied to that area. If you're experiencing any of these signs and you're taking high doses of D3 and K2, it's time to pause and reevaluate. This doesn't mean you should stop everything abruptly, but it does mean your body is sending you signals that something needs to change. So what can you do right now to help your kidneys recover naturally. Hydration is still your best friend. Water flushes out calcium buildup and supports your kidneys' natural detoxification system. But beyond just drinking more water, think about the quality of your hydration. Filtered water is best. Avoid excessive amounts of carbonated drinks or artificial sweeteners, which can burden your kidneys further. Focus on kidney-friendly foods. Berries reduce inflammation in kidney tissue. Leafy greens provide magnesium to balance calcium. Garlic and onions support circulation. Omega-3 rich foods lower inflammation and improve blood flow. Red bell peppers are excellent because they're low in potassium but high in vitamins. Cauliflower provides vitamin C and fiber without overloading your kidneys. Apples contain pectin, a type of fiber that helps reduce kidney strain. It's also a good idea to take supplement breaks. If you've been taking D3 and K2 every single day for months, take a few weeks off and let your body reset. Fat-soluble vitamins stay in your system for a while, so you won't lose their benefits immediately. During this break, focus on getting your nutrients from whole foods and sunlight. Your body will appreciate the rest. Your lifestyle plays a massive role in kidney recovery too. Gentle movement like walking or stretching improves circulation and helps your kidneys filter blood more efficiently. You don't need intense exercise. A 20 to 30-minute walk each day can make a significant difference. Swimming is another excellent option because it's low impact but highly effective for circulation. Deep breathing exercises, meditation, and quality sleep all support your body's repair processes at the cellular level. When you sleep, your kidneys go into recovery mode. They repair damage, balance fluids, and prepare for the next day. One of the most overlooked kidney protectors is fiber. Fiber binds to waste products in your gut and helps eliminate them before they ever reach your kidneys. Foods like oats, flaxseed, and lentils are excellent for this. Fiber also helps regulate your blood sugar, which indirectly protects your kidneys from insulin-related damage. Aim for at least 25 to 30 grams of fiber per day from whole food sources. If you want to be proactive, ask your doctor for a simple urine test. It can reveal if there's too much protein or calcium leaking into your urine, which are early indicators that your kidneys are under strain. A microalbumin test is particularly sensitive and can detect kidney issues years before they show up on standard tests. When caught early, these issues are often completely reversible with small lifestyle changes. Remember, your kidneys are resilient. They can heal when you give them the right environment. Less supplement overload, more hydration, more nutrient-dense whole foods, and fewer processed additives. Now let me bring this all together because supplements should support your health, not work against it. Here's the big takeaway. Vitamins like D3 and K2 are powerful tools, but they're not meant to be taken blindly or indefinitely. Your body's needs change as you age. What worked at 40 might not work at 60 or 70. When your metabolism slows and your kidneys become more sensitive, balance becomes more important than high doses. So how do you use these nutrients wisely? Always test before you supplement. A simple blood test shows your vitamin D levels, and a kidney function test reveals how well your kidneys are filtering. This small step can prevent years of silent damage. Think of it as your health GPS. You don't start a journey without checking your route. The same applies to supplements. Testing gives you a baseline. It shows you exactly where you are and helps you make informed decisions about what you actually need. Follow your body's rhythm. If your blood levels are normal, you may not need D3 and K2 every day. Try every other day or a few times a week, depending on your diet and sun exposure. The key is consistency, not excess. Your body responds better to moderate, regular doses than to high doses taken sporadically. When you do take them, have them with a meal that includes healthy fats like olive oil, eggs, salmon, avocado, or nuts. This ensures better absorption and prevents calcium spikes that stress your kidneys. Avoid pairing your supplement with high calcium foods like milk or cheese in the same meal. That's too much calcium entering your bloodstream at once. Instead, space out your calcium intake throughout the day. Have your supplement with lunch or dinner rather than breakfast if you typically eat calcium-rich foods in the morning. Support your body's natural balance with enough magnesium, vitamin A, and hydration. Magnesium keeps calcium in check and helps your kidneys handle the load. Without it, you're increasing the risk of buildup. Vitamin A works synergistically with vitamin D and helps regulate calcium metabolism. You can get vitamin A from foods like sweet potatoes, carrots, and liver. If you want to get nutrients through food, which is always the best option, focus on real whole ingredients. Get vitamin D from sunlight and foods like salmon, sardines, mackerel, and egg yolks. Just 3 ounces of wild-caught salmon provides over 400 IU of vitamin D naturally. Find K2 in fermented foods like natto, which is a traditional Japanese food made from fermented soybeans. It's one of the richest sources of K2 available. If natto isn't your thing, try hard cheeses like Gouda or aged cheddar and pastured eggs from chickens that eat a natural diet. Include magnesium-rich foods like spinach, Swiss chard, almonds, cashews, and dark chocolate with at least 70% cocoa. Build rest periods into your supplement plan. Every few months, take a short break from D3 and K2, maybe 2 to 4 weeks. During that time, rely on food sources and sunlight. This gives your kidneys a reset and helps your body maintain sensitivity to nutrients. When you take the same supplement day after day without breaks, your body can become less responsive to it. These periodic breaks help maintain effectiveness. Supplements can't fix what poor habits destroy. The best way to protect your kidneys, bones, and heart is through small daily choices. Walk regularly, stay hydrated, eat whole foods, sleep well, and keep stress under control. Your body's healing systems are incredibly smart, but they need the right environment. Chronic stress raises cortisol, which can interfere with calcium metabolism and burden your kidneys. Find stress management techniques that work for you. Maybe it's yoga, maybe it's gardening, maybe it's spending time with loved ones. Whatever brings you peace and joy, prioritize it. Your kidneys will thank you. If you've been taking D3 and K2 for years, it's not too late to change course. I've seen patients lower calcium buildup, improve kidney function, and feel stronger simply by adjusting dosage, improving hydration, and getting nutrients from real food instead of bottles. Health isn't about adding more. It's about restoring balance. Your body already knows how to stay healthy. It's been doing it for decades. Your job is to give it the right conditions and then get out of the way. Before you take another combo pill, ask yourself, does my body truly need this today? Have I had enough sunlight this week? Am I eating nutrient-dense foods? Am I properly hydrated? That one question could save your kidneys, your heart, and your energy for years to come. Remember, your health journey is exactly that, a journey. It's not about perfection. It's about making better choices more often than not. It's about listening to your body and responding with wisdom rather than fear. Every small positive change you make today compounds into significant results tomorrow. If this information has opened your eyes, if you've learned something valuable today, do me a favor. Hit that subscribe button and turn on notifications so you never miss another video from Senior Vitality Pro. We're building a community of informed, empowered seniors who take charge of their health with knowledge and confidence. Share this with someone you care about who's taking these supplements. Post it in your family group chat. Send it to your friends. Knowledge is the best supplement you can give yourself and the people you love. I'm Dr. Elise, and I'm here to help you stay curious, stay balanced, and stay healthy for all the years ahead. Thank you for trusting me with your time today. Thank you for caring enough about your health to watch this entire video. And remember, you have the power to protect your body, to heal your kidneys, and to live vibrantly at any age. I'll see you in the next video.